With school out for the summer, now's a really good time to address your child's ear, nose, or throat conditions, especially those that might require surgery. Dr. Dwight Vaught with Lake Ear, Nose, Throat, and Facial Plastic Surgery explains his approach to working with children and the treatment options available.
When we're dealing with pediatric patients, it's always good to make the child feel at ease. Good ways to do that is to introduce yourself to the child, talk to the child themselves, ask them some questions. Even if they're very young, that really helps them put them at ease and makes them more easily able to cooperate with the visit. And then when it comes time to discuss the diagnosis and treatment options and things, then we kind of focus more on the parents and explaining exactly what's going on and answering questions there. All of the doctors here are parents themselves, so it really helps us be able to empathize with the families, and because we've been through it ourselves. Pediatricians will also send us patients who have had a lot of problems with ear infections, and these are typically the younger kids, anywhere from 6 months old to 3 or 4 years old, and they have recurrent ear infections and have to be on a lot of antibiotics. The problem also causes hearing loss in these children, and the hearing loss is reversible, and it's typically due to having fluid in the middle ear, which is behind the eardrum. Kids who have hearing loss and have had a lot of infections really benefit from tympanostomy tube placement, and that's basically where we put a small tube into the eardrum that drains the fluid out, and typically we can get the hearing restored and they don't have infections anymore. As an ear, nose, and throat physician, we get referred patients that have had recurrent infections in the throat. That includes tonsil infections. Usually once a child has had several tonsil infections, usually anywhere from 4 to 6 a year, we start to think about removing the tonsils and adenoids. Techniques of tonsillectomy these days are much better than they used to be. There's been lots of improvements in the surgical instrumentation, and therefore patients can usually feel better quicker and get back to school faster.
For more information on the diagnosis and treatment of youth and pediatric ear, nose, and throat conditions, and to make an appointment at Lake ENT, please follow the Treating Children StoryLink icon on our homepage, yourhometownhealth.com.